I was diagnosed with colon cancer in April 2024. It is now August 10th, and a lot has happened since then. I've had surgery, and now I'm getting ready for my chemotherapy. I just wanted to share my experience, from the beginning, how I found out, why I took the test, were there any signs, and how the surgery was like, and all the preparations for all that, and now preparing for chemo. So it all started back in like February 2024 when I went in for my annual checkup. I told the doctor that I wanted to get tested for colon cancer, and he wanted to know why, because I wasn't in the recommended age yet. He just asked if there were any issues that I was having, or anything with my bowel movements, with my digestive system. But I told him no. But the reason why I wanted to do it is because I had found out that there was history of colon cancer in my family. He said that, okay, I'll schedule a colonoscopy exam. Before that, my blood work came back and everything seemed normal. The only thing that was unusual is that my vitamin D levels were very low. Every annual checkup that I had in the last, like, I don't know, 5 years, I've been very low on vitamin D. That may not be a sign. I work in an office environment, so I hardly get to have any actual sunlight. So it kind of makes sense that I would test low for vitamin D. I didn't really think much of it. Everything else came back normal for my blood work. But I scheduled my colonoscopy exam, and they give you a kit. And this kit contained a powder mix and a 1.5 gallon container. So I had to mix this powder with water, fill up the container, and then drink it the night before. Starting at 6 p.m., I finished it up around 2 a.m. I had to drink 8 ounces of this mix every like 15 minutes. That was the roughest part of the actual colonoscopy exam process, because it's literally just flushing everything out. You are hardly going to get any sleep. It really sucked. It was horrible, because once that effect started kicking in, you were just constantly in and out of the restroom. You'd spend more time in the toilet than laying down or on your bed. So even until the next morning, till my colonoscopy exam, I was still having the urge to go to the restroom. In the colonoscopy exam, my wife drove me there, and you check in, you undress, put on this gown, and then you're kind of like in this waiting room, and nurses came by. They put an IV fluid, and they said that they were gonna give me some electrolytes. After that, the anesthesiologist came by, and she explained the process, what side effects and things like that. So I had to consent to that. And next thing I know, I go into the examination room, and they wheeled me in there in my bed, and I go in, say hello to all the staff. Everyone's very friendly. The anesthesiologist, I remember that she's saying that if I was ready for a long nap, or a good nap, something like that, and I said sure. I need a nap. I hardly got any rest. And so as soon as she said that she had put the anesthesia, she's like, all right, here we go. Literally, it was like 2 seconds or less. I completely just blacked out. And then next thing I know, I wake up in the same area where I was at. I think even in the same, like the waiting room where I was before I entered the examination room. And, I'm waking up, and I'm feeling very drowsy still, pretty sleepy. And I think the nurse is there, and she's like, all right, everything went well. We'll bring your wife in here shortly. So my wife comes in just a few seconds, and they're asking me questions, if I know where I was at, what had happened, if I knew my wife. And so we're waiting there, and then the nurse says, okay, well, the doctor will come by and we'll tell you about your exam. And I'm waiting there, just kind of talking to the wife. And next thing I know, the doctor comes through like this curtain. It was just a sliding curtain. So he swings the curtain open, closes it behind, and says, well, Mr. Alonso, I have some bad news for you. You have colon cancer. And really, at that time, it didn't even shock me at all. It was just like you get caught in just complete surprise, to hear something like that. And so it didn't really strike me at that time. And the doctor just kind of follows that up with, I'm gonna refer you to a surgeon. We're gonna get you all the medical treatment to get you through this. And I replied to him something like, I'm gonna fight through this, doc, and we're gonna get through it. I'm gonna fight this cancer and beat it. And the wife she was crying next to me, but I was still positive. I'm like, I'm gonna fight this, I'm not gonna let this bring me down. And so that was my first colonoscopy exam. So it was very rough. Later, I'm driving back home and I'm like thinking like, man, that really blows that, you get to hear that on your first colonoscopy exam. And the thing is that, I never had any unusual symptoms, at least not that something that alarmed me or anything or caused concern. I was eating very healthy. I was exercising at least 3 times a week. And overall, I mean, I felt extremely healthy. I was physically fit. I was around 165 pounds at that time. And I just never thought that I'd have colon cancer at all. I just never saw any warning signs. Like, it didn't even feel like there was anything wrong. So it was shocking, thinking back that you could have cancer and really not show any signs until it may be too late. That's the part that is quite scary, to think that there are more individuals in similar situation like me, and they don't go and schedule a colonoscopy exam, and it may be a little too late for them because the symptoms might just happen abruptly and it might be too late. So I would suggest is to get it done as soon as possible. Even if your doctor says, it's not the recommended age. We're starting to see that more people are getting diagnosed with colon cancer at a much earlier age than usual. There's always some news that, someone had colon cancer in their 20s or in their 30s, and they may have not had any family history, or they may not have known. Symptoms could be really anything. I was afraid that I wouldn't be able to sit down or have some pain or discomfort after the colonoscopy exam, but it was actually quite the opposite. I was able to go back to work the next day without any issues. I was able to use the restroom, sit down, eat. That was my experience with my colonoscopy exam. So I scheduled my appointment with the colorectal surgeon, and she kind of went through with what she saw in the colonoscopy report. She wanted to get a CT scan before the surgery itself, because she said that if the cancer has spread, then the possibility of surgery was off the table and that we would go straight to chemo. But if the cancer was only on my intestine, then we would go through with the surgery. So I scheduled my CT scan with contrast. I've never had that procedure done before, and that was kind of weird. Went to this MRI and scanning facility, and I went in there, checked in, and then next thing I know, I go into the scan room, and they asked me if I was allergic to shellfish. So I told them no. They put in this IV, and then they put in this dye to your veins. It's a weird sensation. It felt like cold or something. And there was some people before that had told me that I was gonna feel a sensation to go pee, cold, or just kind of unusual feelings. But in my case, I didn't really feel any of that. Just the cooling, weird sensation of it going through my actual arm into like around my throat. And that's when I realized that I had just a slight reaction to it, because it felt like I had something stuck in my throat. Like I wanted to clear my throat out, and I didn't really get too concerned about it. I didn't even tell the technician there. It wasn't too serious. And after that, got a copy of the image, took it to my colorectal surgeon. Later on, I had to go back and schedule another meeting with her to find the results of my CT scan. And so she said that my CT scan came out good, that there didn't appear to show any indications that the cancer had spread. And then in particular, they were looking for some lymph nodes that were infected with this cancer. And the scans came out, negative. And so we proceeded with the surgery. The day before the surgery, I went through with another preparation kit. This time it was 2 8-ounce small bottles, and I had to mix that with another 8 ounces of water. That was different from the colonoscopy one because this one you just drink it straight up. It was pretty nasty. I took it down fine, but this one was really concentrated because it was just the mix with the 8 ounces, and so it was strong. It was pretty nasty. This one started kicking in right away, and again, this time I had to take it the day before the surgery, and same thing. It was like starting at 6 or 7 p.m. I had to drink a lot of water throughout that whole process. I think it said something like make sure you drink 16 ounces of water within 30 minutes. I did that. I couldn't eat anything at all the whole entire day before the surgery, just liquid. You start going to the restroom, you're flushing your whole system out. The second bottle, I drank it around midnight or 1 a.m. And same thing, mix it up with 8 ounces. And within 10 minutes, I drank another 16 ounces of water. But this time, it made me really nauseous. I was trying to hold it in, but I couldn't. I think it was because I drank really too much liquid and my stomach was just too full, I guess. And so I actually puked a lot of that mix, the second mix. I puked it out. And so I was kind of concerned that maybe I wasn't gonna be clean enough for my surgery. The day of the surgery, my wife takes me in to the surgery. My surgeon is there. She greets me. My parents went in with me and my wife, and same thing. They take me in. I check in. I go into the preparation room. These nurses administer an IV, and I just wait for the time of the surgery. And well, the time of the surgery is scheduled. I forget exactly, but it's around noon. And then from there, I wait for the anesthesiologist comes in. She explains the whole situation, what the side effects are, and all that. I have to consent again. And then from there, the anesthesiologist says that she's gonna give me a margarita shot, which I thought it was pretty funny. But yeah, she administers this whatever medication it is, and I feel very calm. It feels like you've had a lot to drink. You're just mellowed down a lot and just relaxed, very calm, and you feel kind of like in Zen or something. It was a strange feeling. So I remember that they're rolling me around the hallways into the operation room, and I'm really relaxed talking to them. I feel really calm and happy. And the next thing I know, I go into the operation room. Everyone's there. The staff is very polite. They greet me. They ask for my name, confirmation, my age, birthday, and all that. And we go through with the procedure. And this time, same thing like before. I mean, I don't remember how long I was there in the operation room before I completely blanked out. Next thing I know, I'm in this waiting room, just feeling kind of really, really sleepy. Try to open my eyes. And slowly, I start waking up. And I don't remember exactly. My wife is there. My mom is there. They tell me that the procedure was 5 or 6 hours long. So it was quite a long procedure. But everything went well, and the doctor didn't come in to visit me in the recovery room. She came in later on. But, right there, my wife and my mom is there. And then I remember that there was a nurse that was telling them that she said something like, who told him to get a colonoscopy? And my wife's like, he decided to do it. And the nurse says, well, he saved his own life. She ended up telling a story. One of her friends passed away from colon cancer at a very young age, like in her 30s, and never had any signs, any symptoms. And it was quite a sad story to hear. But after that, they transferred me over into a patient room. I stayed in the hospital for the procedure was actually on a Friday. I was in the hospital until a Sunday afternoon is when I was released from the hospital. But during my hospital stay, at first, because I have anesthesia around my abdomen where they did the surgery, I didn't feel too much pain. But slowly, the next day or around in the early morning, and that's when I started to feel that the anesthesia was wearing off. I was in pain. I mean, I could barely make any movement in my abdomen area. I had to use a lot of my arms and legs to kind of lift myself up or move me around. No laughing. I mean, I tried not to laugh and tried not to cough because that was just very painful. So I'm in the hospital there. They're giving me, medicine, antibiotics, and all these other medication. They're keeping me there to monitor me. One of the things I remember is that I had to take this medication. It was like a blood thinner around the surgery incisions so that I don't get any blood clots in that area. And so it was painful, but it was only once a day. They pinch you and then they stuck that needle in there. So it was just a burning sensation. I mean, probably like a wasp sting or something. So I was able to just eat just liquids the first day. I was just strictly liquid, just broth, jello, nothing solid. They basically kept me in the hospital just so that, I didn't run into any complications, get sick or anything like that. It was mostly just a liquid diet from there on. I was released on a Sunday and then went home. The drive home was rough because any little bump, I would feel it. It would hurt. Once I'm home, I'm just getting a lot of rest, eating a lot of jello, a lot of yogurt, keeping hydrated, Gatorade. That first week after the surgery, I stuck to liquid and soft foods like jello, yogurts, and pudding. And it wasn't until my second week where I started eating, a little more solids, nothing heavy. I was recovering very well, honestly. I'm very grateful that I have a wonderful wife who was there all the time to lift me up, to help me lay down, and to bring me my medications. I just have a wonderful woman, partner, wife, friend, lover. She is amazing. And so, we're going through this journey together, and as well as with my two boys. My recovery, I slowly started to walk around, getting up from my bed, sitting up and down on my couch, and started moving around. It took about 3 weeks to fully recover, where I could do things that I normally would by myself. And I had gone back to work after 2 weeks, but I should have just taken 3 weeks completely because it was pretty painful at work, sitting down. It was a bad decision to go back after 2 weeks, really. But 3 weeks, I think, is a good time frame for a good recovery. Like, not 100% obviously, because I couldn't go back to my exercise routine. That was rough, to just sit around, not do anything. You feel demotivated, really. That's the only part that was the hardest after the surgery, the recovery time. But after the recovery, I mean, everything seemed well. I recovered very well. I was waiting for another visit with the surgeon because she was gonna go over the pathology report of the intestine that had the cancer. The surgeon had told me that they were going to go ahead and take out additional lymph nodes around the area just to make sure that the cancer wasn't spreading, just to be safe. And so I had my post-op surgery visit with her, and unfortunately she gave me some bad news, which was that she took out 17 lymph nodes, and out of those 17, I think like 6 of them came back positive with cancer cells or whatever they're looking for. And she said that, we'd have to get chemo right away, because it's very likely that the cancer will come back. And so we're trying to do that to prevent it. That one was a real bummer to hear that, because I thought that once they got the part with the cancer removed, that I would be good. I'd go back to my normal life. Well, unfortunately I can't, because now I had to go schedule an appointment to have a port implanted around my chest, my top right, around this area here. That procedure, I had it done. I was awake. They just kind of localized the anesthesia around here to insert this device for the chemotherapy pump that they're gonna give me. I just went in. It was a quick procedure, like 30 minutes, 40 minutes maybe, tops. It was kind of weird because they make an incision around here, I believe, and then over lower, and then they implant this device in directly under your skin right here. It was kind of weird because they gave me some kind of medication where I could just calm down, but I could still feel that they're moving things, inserting things in here in this area and moving it around. Through that whole procedure, I was awake. It didn't really seem that long. I think that medication got me very sleepy, so I don't really know if I even slept a little bit or not, but it didn't seem that long. And after that, I go back to the patient room again. My wife is there waiting. I got released that same day. Nothing unusual. After the anesthesia wore out, it was kind of painful. And one thing about that procedure is that they cover this whole area with a plastic wrap or band-aid or something. And this thing, because of the way that you're awkwardly flexing your neck during the procedure, when they put that tape on, it actually started to peel some of my skin off right here, and it was so painful because it felt like when you burn yourself, the tape was actually pulling my neck like this. I was, having to turn like this, and so that tape, I guess, started to peel my actual skin slightly. And so, I told the wife, "What do you see over here?" And she's like, "Oh my God, it's blistering up." She thought that it may have been an allergic reaction, but that tape was actually literally peeling my skin off. And because it was only in that area, not in the whole area of the tape, it was just particular here. And I was constantly moving my neck like this, and so it peeled a lot of that skin off. And then my wife had to just basically peel the tape off slightly and reposition my neck, and then my wife was able to just put that tape back in there because I couldn't let any water in this area here because of risk of infections. After that, everything went well. It's kind of uncomfortable to sleep on the side. I basically sleep on my back, or sometimes I'll toss to the other side. But you can feel it if you move your arm all the way up. You can feel something in here, certain positions. You can feel that device in this area. I start my chemo here in 2 days, so it's gonna be tough. They already told me what I'm gonna go through. We're gonna go, and get it done. And my treatment plan is gonna be every other week. I start my plan on a Monday. I'll go in. They put the device in with the medication. It's like a pump that I'll get to take home. For 72 hours, it releases the medication, and then after that, I'll go back to the clinic. They'll take the pump off, and I'll go back home, and then I'll get a week rest, and then I'll do the procedure again. Every other Monday, I'll do the chemo, and hopefully everything goes well. If my immune system is too low, that's when they'll might postpone it, but they're gonna have blood drawn every Thursday or Friday before the chemo so that they can check all my red blood cells, my white blood cells, whatever they're going to look for, just to give them any indications if they can proceed with the chemo or just maybe postpone it. So I'm keeping my head straight and shoulders up, and we're going to get through it. And I'm going to just share this process, and hopefully, this will encourage me, also give me some motivation to get through it. But I have a lot of support with my family, with my wife and my kids, and hopefully be cancer free after this treatment. So I will keep you posted for my next video. If I'm feeling well enough, I'll just do my first chemo treatment, and we'll see how that goes.